Speaking of which, onto a potentially huge innovation in healthcare. If you've watched me for a while, you know my dad was a surgeon, and he used to say, if you want to get really sick, go to a hospital. What did he mean by that? Well, the U.S. Center for Disease Control and Prevention says healthcare-associated infections, like infections you get in the hospital when you're in there for something else, cause approximately 90,000 deaths per year and cost some $4.5 billion in excess healthcare costs. But my next guest says a provision in the Affordable Health Care Act is going to change that. Yeah, something good out of this thing. And his company stands to benefit because it's a product that it makes. Steve McMillan is the former Stryker CEO and is currently Biomed CEO. He's joining me now on a Fox Business exclusive. The numbers were staggering, I thought. 90,000 people die after they go in for one thing in a hospital and get some type of weird infection in the hospital.
That's exactly right, Liz. You look about it with C. diff, MRSA, staph, all these things. We're effectively having a plane crash every day in this country.
Staphylococcus, all kinds of weird stuff.
All kinds of various infections, and people do. Increasingly, people are getting concerned about going in for surgery because almost everybody knows a family member, a friend, who's come out of the hospital and gotten sick afterwards. Now stop this.
David Darst was just leaving the set, and he said Barton Biggs, who was a famous market participant in New York here, same thing. He got a hospital infection and died.
Well, and they're now preventable. With STERIPLEX, we really think we've got the product that can help eliminate this. The Huntsman Cancer Center put it into their toughest unit they have in their hospital.
That was your test hospital, right?
Yes, it was one of the test hospitals.
In Utah, which is where you're based.
Yes, they put it in their bone marrow transplant unit. They decided, let's put this in the harshest environment, the real world environment. They've completely eliminated their healthcare associated infections.
100%?
And we know 100% for over 6 months now. So we know it can be done, and frankly, it's just a matter of having a better product that kills stuff to a level never seen before. And frankly, the other part is it's less toxic and safer than anything on the market. This product's actually approved for food surfaces, for children's toys.
What's in it? I mean, I know you're not going to give your recipe, but is there anything toxic in it?
No. The special magic of this is it's actually less toxic. It is basically activated silver. Everybody knows going back centuries that silver has been a very great antimicrobial, a naturally occurring antimicrobial, and that's the active product formulated very differently from anything that's been on the market, but that's probably the single biggest breakthrough technology.
Okay, so folks, you have to understand this stuff is 1,000 times the power of Lysol. It's been approved by the EPA, but here's where the Affordable Health Care Act comes in. Hospitals are being told now that Medicare will no longer reimburse them for hospital infections, meaning people. So the incentive is now there for hospitals to clean up their act.
Yes. I mean, Liz, you know from the past, I have not been the biggest fan of all of the healthcare provisions. But like everything, there's the good with the bad. One of the great provisions I think they did put into this healthcare bill, and we are, selfishly uniquely poised to capitalize on it, is hospitals will no longer be reimbursed, and they will need to report on their healthcare associated infections. So what this means is starting January 1st, all of the hospitals will look at these as a cost center, and it's getting much greater scrutiny, which will be better for reducing costs and improving care.
So you did the Huntsman Center. Now you're in HCA hospitals?
Yes, we're in some HCA hospitals.
Why isn't everybody signing up with this product?
The product literally has just been getting cleared. It was just cleared in California 2 weeks ago. So we're right at that stage after 8 long years of development of just bringing it to market right now. We just got into a big hospital or a big ambulance system in Tennessee this morning.
I have to ask you a question. Doctors' ties, as in the ties they wear as they bend over a patient, the 20th patient of the day, and that tie has some type of infection on it in many cases. Isn't that a root of the cause of these infections?
Ties, hands, you just think about their hands, bed rails, by the way, the safety of this, here we go. So
did you just spray that on your clothes?
I just sprayed it on a very nice tie on myself.
And it won't ruin it?
No, and if you think about most of, this is what the healthcare workers, you think about the nurses, the dental hygienists, everything, they're so used to dealing with bleaches and other things that are very toxic. This it has no volatile organic compounds.
Biomed is not publicly traded yet. However, you're going to allow private investors to buy shares? How is that going to work, and when can they do that?
Yes, we actually have a limited private placement memorandum going out over the next few weeks that for accredited investors, very limited fashion, will be taking in some additional money, but not kind of for the broad scale.
Maybe I'm going to spray this all over Charlie Gasparino's keyboard. He brushes his teeth in his office.
By the way, if you want to, How safe?
Did you just lick your hand?
And I just licked that. That's,
I'll do it.
This is part of the magic. You know, doesn't taste as good as your standard five-star
It's like a cross
restaurant.
between mouthwash and something else.
Yeah, there's a touch of a wintergreen scent in it even.
Steve,
but,
it's great to see you.
Oh, well, thank you, Liz.
Stephen
Thanks for
McMillan,
having
and
us.
he knows from medical devices and all of that world, having been the former Stryker CEO, he's now with S-Biomed, and the product is called STERIPLEX. Tell your hospital, 1,000 times stronger than Lysol. Good luck to you. Keep us posted.
Thanks so much, Liz. Thank you.
Dow Jones Industrial